We're back now with some important advice for parents of infants. You can have your child's vision checked for free through the Infant C program. And here to tell us more about that is optometrist Dr. Gina Wesley and her son Quinn, who happens to be a ham.
Yes, he is.
Great. How you doing, buddy? Good to see you. Yeah, welcome to the show. The happiest baby ever. Dr. Gina, tell us about the Infant C program.
Well, the Infant C program is this wonderful public health program through the American Optometric Association. It allows babies ages 6 to 12 months to have a comprehensive exam at no cost by an infancy provider who is an optometrist who's volunteered for the program. And it screens to make sure there's no early risk for eye disease or eye issues.
You've screened over 150 infants.
Yes.
What are you seeing? I'm sure a lot of parents out there don't even think of having their child's vision tested until they're in school, you know, 5 years old, 6 years old, but you're doing it at a very young age.
Right, and we're screening for any early problems because what they were noticing is that kids are getting into school and they were having issues and problems that weren't detected at a young enough age, so they were suffering from vision problems and vision loss and falling behind in school.
So if you catch it early, what are some of the steps? Obviously, corrective lenses, possibly surgery.
Possibly, absolutely. And that's one of the things is that these little eye turns and lazy eye and the ones that you can and can't see, those vision errors that kids don't necessarily know to tell their parents that they're having trouble with, can cause problems in school, and that's where we really try and help kids out.
You brought some of the tools with you that you use for your exams, and through my daughter at the eye doctor, we've used these too, and what are they for?
Now, these are grading paddles that allow us to test a baby's vision and how they respond to detail. The finer the detail, the more difficult it is for them to see it. So when we're looking to see how they're responding, we compare it to just a blank one, a little bland one here.
Okay.
And that is a way for us to get a little bit of a subjective response. But of course, most of the exam gives us objective data. Things that I can see.
It's got to be pretty challenging. Obviously, infants can't talk and tell you what they're seeing. And can you know, when you examine an adult, so what are you seeing? How many fingers am I holding up? But with an infant, you really got to follow their eyes and.
You got to follow their eyes. You got to look at the light reflex, and you also can see. You know, asking parents, are they rubbing their eyes? Are they really crabby at the end of the day? You know, their eyes may be tired because they're trying. It could be.
Okay, we have some other tools for your exams here too, and I've seen these. What do these tell you?
These are lens bars, and they allow us, when I use this special light called a retinoscope, it allows me to be able to tell what their prescription is by holding it in front of their eyes and flashing it, and I'm looking for a specific reflex. Once that reflex is what's called neutralized, it's the old way of being able to tell what people's prescriptions are instead of the automated instruments.
What are the numbers for it? What's the term I'm looking for? Vision abnormalities or what are the numbers like? If you've looked at 150 infants, what's the percentage?
About 20% of infants have something that needs to be monitored, treated, or watched.
So it's pretty prevalent.
It is. It's more prevalent than you think. And sometimes the problem is something that it's very easy to correct when they're little, but if it got all the way to age 5 or 6, it would be a serious problem.
Right.
So we just have to be very, very diligent about making sure that they are being educated and making sure that we're communicating with their pediatricians and letting them know what exactly is going on with their vision.
Let's talk a little bit more about the Infant C program then. This is available to everyone. It's a public health program.
It's a public health program. If you go to infancy.org, if you go to infancy.org, you'll be able to find a provider.
Takes after Dad, huh?
Yes.
That's great.
So.
Now, have you checked out Quinn's eyes?
He's had several eye exams at this point.
I bet he has.
Yes.
This is probably one of your favorite toys, isn't it?
Yes. It's been chewed on a few times already.
Very good. Okay, now then, did you say I was distracted by Quinn here? I'm sorry. Did you say how people can get more information on this program?
If you go to infancy.org. And that's S-E-E at the end of infant. You'll be able to find a provider in your area.
Very good. I'm going to repeat that right now. Thanks for bringing Quinn, and good to see you again.
Yes, thanks so much.
For more information on Dr. Gina Wesley and any of the things we talked about, visit showcaseminnesota.com and just click on the Tuesday link. Up next, give a pint and get a set of wheels. More on the Red Cross campaign to encourage blood donation.